to talk about some things that you can do if you miss a vein whenever you're starting an IV. It's something that you just don't want to do, whether you're a new nurse or a seasoned nurse, but it's something that unfortunately does happen, even for the most seasoned nurse. There will be times where they miss veins. So, as the nurse, you don't want to miss that vein, because usually whenever you're having to start an IV on a patient, it's for a reason. You've got to give a medication that needs to really be given right then and there. Or if you're the patient, you don't want to have to be stuck with a needle over and over. So first, whenever you do miss a vein, you want to make sure that you have a good reaction to it, because you don't want to have one of the two extremes. Like, one extreme would be that you blame the patient for why you missed the IV, like telling the patient, oh man, you have horrible veins and I couldn't get it. I don't know how anyone really gets an IV on you. That could really offend the patient and make them feel bad about themselves. Or you are just overly apologetic and you're like, I'm just so sorry, I'm so sorry, I'm just really not good at this, I'm new here, and just keep apologizing. Instead, you want to be tactful with how you respond. Another thing to keep in mind if you do miss is to always ask the patient's permission if you can attempt to stick them again, because some patients I have found, they will actually tell you, no, I don't want any more attempts, I'm not having an IV. And then also, you want to look at your hospital's protocols, because many times these protocols will dictate how much an individual nurse can attempt to stick a patient for an IV, and sometimes it's limited to 2, so you always want to be familiar with that. And the next thing is that you have to maintain confidence, especially whenever you miss after that first attempt. So, whenever you do miss after that first attempt, your confidence is already like deflating and you're thinking to yourself, oh no, I hope I really get this. Especially if you have a patient who is really putting the squeeze on you and they're saying, okay, you're not trying anymore after this. Or you have family members who are really just like, you're not sticking them anymore. Whenever I first started out in nursing, and at that time I wasn't that great at IVs, but I was trying. And I go into the patient's room, need to start an IV. He was like, you get 1 stick. I was like, okay. And I was thinking, okay, I hope I really get this. And so I go to start it, and he's like, there at the bedside, like watching me like a hawk, making sure I'm doing everything right. And guess what? I miss. And I felt about this big and just wanted to die, really. But anyways, I had to go get another nurse who was seasoned, and she came in and tried, and unfortunately she missed the first time, but she was able to talk the son into allowing her to try again, and she got it on her second attempt. So you really have to watch that, and you have to try to maintain your confidence whenever, things are making you feel like, oh no, I don't know if I can get this. Unfortunately, sometimes you may not be able to find anything in the antecubital fossa, in the forearm, or on the dorsum of the hand, and you may have to get the doctor's permission in order to do that. And another thing, if you are missing veins a lot, you need to step back and ask yourself, okay, why am I missing these veins? What is going wrong? And some things that can go wrong is that you're just not finding a vein to use that is actually able to hold that gauge you're using. Another thing is that, are you hitting the vein, so you're getting the blood in the chamber, but whenever you go to thread it in, you're having difficulty. It's causing the vein to blow. Well, that could be because you're not going in far enough with that needle in order to slide that cannula off into the vein. That's a big common problem that some people have. And then another thing you can do is, if you have access to a vein finder or a vein light, these are really cool tools that are non-invasive. You can put them on the skin and it'll help light up where that vein is located. Or you can get ultrasound to help you out with this. It really varies on what you have access to in your hospital, but I have had ultrasound for patients who are really hard to stick. They will come and they will actually ultrasound the vein, and they will actually stick the vein and get the IV. And it may be that your patient just literally has nothing to choose from, so they may be a candidate for a central line. And lastly, if you find yourself being in that situation where you're just missing veins all the time and you're never getting them, don't think that this is just a skill that you're never going to get, because this skill takes lots of practice. Unless you're one of those people who came out of nursing school just being like naturally awesome at starting IVs, most people, it takes lots of practice. And for me, whenever I was a new nurse, this took practice. And I know it can be difficult whenever you are missing all the time, and maybe a patient has said something to you which squishes your confidence even more, or maybe a coworker is giving you a hard time about it. But whatever it is, just push that out of your mind and just say, okay, I'm going to keep practicing. I'm not going to give up. Because one of the worst things you can do is just quit trying and just keep asking people to start your IVs for you, because there's going to be times when this patient needs this IV now because the IV blew, you have some fluids or antibiotics to run, you need the IV, and you go out to look for someone to help you, and it's like a ghost town, you can't find anyone, and it comes down to you. And this is really a skill set that you have to have. So what you want to do is you just want to practice. Take every opportunity you can to practice. And I know whenever you are first starting out, this skill seems so complicated because you have to first find the vein. Then you have to stick the vein to secure it down. And it seems so just difficult. But over time, when you do this over and over, you're going to get it. And before you know it, people may be coming to you to get you to start their IVs. So don't give up.